So once you've decided to have this procedure done, what is the process? So you've scheduled the procedure, we give you some instructions. There's really no preparation per se to get ready for the procedure. But basically you come in, we mark out where we're going to put the grafts very specifically, very fastidiously that day. And then we do have to cut the back of the hair, shave it short, almost like a military cut. Now remember, the back of the hair grows very fast. We have pictures and we can show you, of course, where the grafts come in within 2 weeks. Basically your hair is, you can't tell I even took the grafts. We then put you in the procedure room. The grafts that we are going to take, we know the density of the area of the grafts, so we know how many grafts we can take. Most we can take usually in one sitting. If you have really dense hairs, like up to 2,500 grafts, which is a nice session in which we can get a lot of results from that. Sometimes we can only get 1,800, but nevertheless, we'll be able to determine that. We'll set the grafts aside. We have one technician which is helping me take the grafts, then another technician that's preparing the grafts. Then we take a little break once we've taken all the grafts. You get a little lunch, we relax a little bit, and then we get you ready to put the grafts in. And that's based on where we want to thicken the area where you've lost some hair, and we put the grafts in those areas. And then what we do is we actually put a little medicine around it to help stimulate them. So the FUE procedure, remember, we're taking the grafts, we're taking a little break to give you a little rest and give you a little bit of downtime, and then putting the grafts in. Total procedure takes anywhere from 4 to 6 hours depending on how many grafts we're putting in. So the nicest part of the FUE, which goes by the name really NeoGraft, because that's kind of the machine itself is what it's called, but it's really called Follicular Unit Extraction. Last is scarless, because there is no incisions, because basically we're taking each graft individually with a little device or apparatus or robot that takes those grafts, and then we're planting them in without an incision. So you will have a scarless procedure. So in taking the grafts, we actually use a little machine that extracts the grafts from each area without disturbing the next follicle. So that the advantage of that is that you still have the growth in the donor area, so you don't even, over time when the hair grows back in, you don't even see that we took the graft. Now in inserting the grafts, we do that by hand still. I think that's important to know, because some of the big clinics now are using a robot or something where it's basically all done, and the hair has to be styled a certain way, and each individual person has a different hairline. So it's very important. There is where we have a big difference. It's stylized and personalized to your particular hair growth and the way your hair comes in.